Very good evening, one and all. So, here we are again with another interesting session of our live platform presentation. This is our 15th virtual platform presentation. So, I welcome you all on behalf of our B-GHUD family. Thank you all for your cooperation so far, what you have extended. So, I look forward to see your cooperation and your participation in this virtual platform presentation. Okay, so this is our 15th session. So, all our students are our OET aspirants, all our students, those who wish to migrate abroad, those who wish to cherish their dreams abroad in English speaking countries, they are just getting us very good feedbacks. So, this is what make us more and more energetic and enthusiastic to do our sessions more actively. So, എല്ലാവരെയും വെൽക്കം ചെയ്യുന്നു, എല്ലാവരും സന്തോഷമായിട്ടിരിക്കുന്നു, സമാധാനമായിട്ടിരിക്കുന്നു എന്നൊക്കെ ഞാൻ വിചാരിക്കുന്നു. അപ്പോൾ നമുക്ക് നമ്മുടെ 15th വെർച്വൽ പ്ലാറ്റ്ഫോം സെഷനാണ്. അപ്പോൾ നമ്മുടെ സ്റ്റുഡൻസ് എല്ലാവരും ഇത് നന്നായിട്ട് യൂസ് ചെയ്യുന്നു എന്ന് അറിഞ്ഞതിൽ നമുക്ക് വളരെയധികം സന്തോഷമുണ്ട് കേട്ടോ. സോ ഐ വുഡ് ലൈക്ക് ടു എക്സ്റ്റെൻഡ് മൈ ഹാർട്ട് ഫെൽ താങ്ക്സ് ടു ഓൾ മൈ ഡിയർ കൊളീഗ്സ് ദോസ് ഹു ഹാവ് എക്സ്റ്റെൻഡഡ് their participation in making this session possible. Let me extend my thanks to Mr. Joyson, Mr. Jobin, and also to my dear all other people, Vipin and all my dear colleagues, those who have extended their heartfelt cooperation in making this session possible. Okay, so once again I welcome you all. അപ്പോൾ നമുക്ക് നമ്മുടെ 15th സെഷനിലെ ക്ലാസ്സുകളിലേക്ക് നമ്മൾ പോയിക്കൊണ്ടിരിക്കുകയാണ്. ഓക്കെ, അപ്പോൾ നമ്മൾ എന്താണ് ഫസ്റ്റ് നമ്മൾ എല്ലാ ക്ലാസ്സിനും മുമ്പ് ഓരോ ചെറിയ ചെറിയ സ്റ്റേറ്റ്മെൻറ്റ്സ് നമ്മൾ ഡിസ്കസ് ചെയ്യുന്നുണ്ടായിരിക്കും. അപ്പോൾ കഴിഞ്ഞ തവണ നമ്മുടെ സ്റ്റേറ്റ്മെൻറ്റിനകത്ത് പറഞ്ഞത് റിഫ്ലക്റ്റിംഗ് നോൺ വെർബൽ ക്യൂസ് എന്നായിരുന്നു. റിഫ്ലക്റ്റിംഗ് നോൺ വെർബൽ ക്യൂസ് ഇൻ ദ സെൻസ് വി ആർ അസസിങ് ദാറ്റ് പേഷ്യൻസ് ഓർ ദാറ്റ് ഇൻ്റർലോക്യൂട്ടർ whatever the role the interlocutor plays, we are just assessing their facial textures, their grimaces, their faces and all their feelings, their emotions and all, and we are just bringing it into our communication. So ഓപ്പോസിറ്റ് ഇരിക്കുന്ന ഇൻ്റർലോക്യൂട്ടറിൻ്റെ ഫേഷ്യൽ ഗ്രിമേസ്, ടെക്സ്ചർ, ഇതെല്ലാം നമ്മൾ എന്തോ ചെയ്യുന്നു, നമ്മൾ അസസ് ചെയ്തിട്ട് നമ്മൾ എന്ത് ചെയ്യുന്നു, അതിനെ കമ്മ്യൂണിക്കേഷനിലേക്ക് കൊണ്ടുവരുന്നു. ഇറ്റ് ലുക്സ് ലൈക്ക് ഓക്കെ, ഇറ്റ് സീംസ് യു ആർ ഡിപ്രസ്ഡ്, യു ലുക്സ് ആംഗ്രി, ഓൾ ദോസ് തിങ്സ് വി ആർ ഡിസ്കസിങ്. സോ നൗ ഹിയർ വി ആർ ഡിസ്കസിങ് certain statements that could reflect their verbal cues. Okay, reflecting verbal cues. That means here we are just reiterating, we are catching certain points or certain dialogues that the examiner or the interlocutor what they are displaying, what our patient or our bystander, whoever it is, who are displaying those verbal statements. We are just reiterating the statements that our interlocutor is saying. അപ്പോൾ നമ്മുടെ interlocutor പറയുന്ന ചില verbal comments-നെ നമ്മൾ എന്ത് ചെയ്യുന്നു, അത് ക്യാച്ച് ചെയ്തിട്ട് നമ്മൾ അതിനെ ഒന്ന് റിഫ്ലക്റ്റ് ചെയ്യും. ദറ്റ് മീൻസ് വി ആർ ജസ്റ്റ് reiterating, we are just reflecting it back, we are just making them know that whether they have gone through that particular point. Okay, അപ്പോൾ അവർ പോയത് ഇന്ന കാര്യമല്ല, അവർ പറഞ്ഞത് ഇന്ന കാര്യമാണോ, അവർ സ്റ്റേറ്റ് ചെയ്തത് ഇന്നതാണോ എന്നുള്ളത് we are just reflecting, we are just reiterating those statements which is made by verbal statements, not their facial grimaces, actions or textures. We are just catching their verbal statements. Okay, so what are all the things? If my students are there, means if my participants are there, means please try to give me some comments. Okay, if you have got any idea regarding, so I know that you people are using in your dialogues, in your OET role plays and all, so please get me some, could pin your suggestions and comments over here, just get me some comments. Okay, just get me some statements that you know how to reflect the verbal cues made by the students. I'll give you 1 or 2 minutes, please get me that. Okay, if you have got any idea. So let me start, I'll give you one point, I'll start now. So after that you can just get me some statements if you are aware of. Okay, so you can say like simply, you feel that, okay Mr. Matthew, you feel that this treatment is worthy. Okay, Mr. Matthew, you feel that this treatment is effective. All those things that you can say, you feel that. Okay, then you can say like, you believe that, you feel that, you believe that. Okay, so through their statements we are just taking all those things, we are understanding their statements and we are just reflecting it back. Okay, then you conveyed that. Okay, so you conveyed that, you are not able to go through all those complementary measures, you conveyed that. Okay, if I understand you correctly, another one statement that you can make is like, if I understand you correctly, if I understand you correctly, ഞാൻ മനസ്സിലാക്കിയത് ശരിയാണെങ്കിൽ, you conveyed that, നിങ്ങൾ എന്താ പറഞ്ഞതെന്ന് വച്ചാൽ, you feel that, നിങ്ങൾക്ക് അങ്ങനെ തോന്നുന്നുണ്ടല്ലേ, ഓക്കെ, നിങ്ങളുടെ അത് you believe that, നിങ്ങൾ ഇതല്ലേ വിശ്വസിക്കുന്നത്, ഓക്കെ. And if I heard you right, if I ഞാൻ കേട്ടത് ശരിയാണെങ്കിൽ, if I heard you right, okay, so you believe that, you feel that, if I heard you correctly, if I heard you, ഞാൻ കേട്ടത് ശരിയാണെങ്കിൽ, okay, then what else, if I understand you correctly, if I understand you correctly, you are saying that, നിങ്ങൾ എന്താ പറയുന്നതെന്ന് വെച്ചാൽ, you are saying that, നിങ്ങൾ എന്താണ് പറയുന്നതെന്ന് വെച്ചാൽ, okay. So all these are certain statements that you can so there are some other statements to say. I am not getting any response from my dear students. So it sounds like, so it sounds like, so when the patient is saying something, yeah, so it sounds like you are not interested in going for this therapy, okay, so it sounds like you are not ready to continue your stay in this hospital. So that is what, how we are just reflecting all those things. In other words, in other words, okay, you can say like, so it sounds like, in other words, okay, you mean, okay, so നിങ്ങൾ ഉദ്ദേശിക്കുന്നത് എന്താണെന്ന് വെച്ചാൽ, you mean, you're not ready. So these are certain statements that we can use. So you can write it, you can by heart it and try to apply it in your role plays. Okay, these all will fetch you more score, because that shows that you people are very good at your English language. You know how to deal with the language. Okay, so that is what. See, Mane, among my gang, I just forgot to catch my dear Roshan's name. Okay, Roshan, I'm very sorry, da. I was at that time, I was just there. Fickling thoughts was there. So many things were there, and I was not able to catch my dear Roshan's name. So I would like to thank my guy, all my so Joyce and Jobin and my Vipin all are there. So it is not fair if I don't catch my guy's name. Okay. Okay, so Maklai, I hope everything is clear so far. You have, I want all of you to write all these things. Could scribble it down anywhere, try to by heart this, and I want all of you to use this whenever you display your role plays. Okay, these all are very helpful. These all will help you to fetch more score. This all shows that you people are proficient in your language. Okay, so that is what. Hope all are doing good and fine. All are there with me. Okay, my dear students, at least you can get me some messages. You could get me some thumbs up, actions, reactions, or your emojis, whatever it is. You could pin your suggestions, your statements here. I always welcome that. That would be a piece of appreciation for me if you do all those things. Okay, so these are certain statements you can use to reflect the verbal cues in order to reiterate the statements which were made by the patient. Okay, so previously, so every week I am just discussing you all those things. Previously it was reflecting non-verbal cues. That means they are not verbal statements. Instead, we are just appreciating the patient's appeal, their gesture, grimaces, all those things. Okay, emotions, feels and all. That is what. Hope everything is clear. So now it's time for us. I'm not wasting any of this time. So I want no. So now it's our session to go for our role play. Now it's time for us to discuss our role play. Soon we'll start displaying the question. You can go through that. We'll have a detailed discussion of that, and after that I'll be giving you dialogues, and we'll be closing session after that. Okay, so you can display the question. Okay, so we'll go for our discussion. Please have a look onto that question. I want all of you to read the question thoroughly and interpret it properly. Okay, so the stepping stone to success, yes, when it comes to speaking is like appraising the questions carefully. That is what all my dear students should do. Okay, so keep a close watch on the question, understand it properly, read it properly, understand it properly, write the needed points and all, and cook your dialogues. Okay. So, wherever you feel something confusing, make sure that you are just going through that session properly, that area properly, and can make your dialogues factually. Okay. So, some educated guess and all, in case if you are not sure about some statements, you can just give an educated guess too. So, അപ്പോൾ എല്ലാവരും എന്ത് ചെയ്യണം, ക്വസ്റ്റ്യൻ കിട്ടുന്ന സമയത്ത് ഭംഗിയായിട്ട് അത് വായിച്ചെടുക്കുക എന്നുള്ളത് തന്നെയാണ് ആദ്യത്തെ the first stepping stone to success when it comes to our speaking module. Yes, see, setting is hospital accident and emergency department. Your patient has come to emergency department because he or she thinks he has a broken toe. It is a very busy weekend, right? And the patient has been waiting for some time. Okay. So, now so the patient, the setting it is given is like hospital accident and emergency department. Okay, the patient has come to the department because that patient feels like yes, he or she has a broken toe. Okay. So, they had a fall, they have so the patient believes that he or she has a broken toe. It is a very busy weekend, okay, night. When it is night, okay, it is not right, it is weekend night. Okay. Yes, weekend night, and the patient has been waiting for some time. Yes. Okay. So, now we have to so the patient is waiting here in this, it is a weekend night, evening time. So, the time indication is given in a hidden format. So, you can start by a good evening. So, the patient is waiting here for some time. You need to notice that the patient is waiting here for some time. Patient has been waiting here for some time. So, the patient believes that he or she has a broken toe. So, this is accident and emergency department. Find out what happened to the patient's foot and their mobility pain. So, we need to assess their condition as a fresh case, as an unknown case. We can start this. It is a busy weekend night. Okay. So, we can organize all those, you can catch all those points and make some catchy introduction. Okay. So, taking all those things, we need to assess what has happened. So, assess their pain, mobility, explain that you do not know whether it is broken, but the procedure is same for a badly hurt or broken toe. So, they may be asking like whether they had broken toe or something. They may ask whether there is any fracture, but we have to say that we are not the authority to confirm whether there is a broken toe or something, but we can say that the procedure would be same. Okay. So, whether it is for a bad toe or for a badly hurt toe or a broken toe, almost the procedure is same. That means dressing and taping it to the next toe. So, we are just dressing and taping the toe. That is what the procedure that we are doing usually. Explain that an X-ray would mean a very long wall and have no bearing on the treatment. The hospital is busy with emergencies tonight. Okay. So, the patient would be requesting for an X-ray. Okay. Okay, the patient would be requesting for an X-ray. The patient may request an X-ray, but we have to say that it takes more time because this is a busy weekend. Okay, it is a busy weekend. The hospital is busy with emergencies tonight. Okay. So, night it is quite busy. So, it may take a very long wall, in the sense they have to wait long. It may take more time. That is what it means, that idiom means. Okay, and have no bearing with the treatment. So, with the X-ray, nothing is going to work with the treatment. In treatment, this is not going to work, X-ray. So, we can say that now indirectly it means that now there is no need for an X-ray. Okay. So, we are just trying to convey the patient that there is no need for an X-ray. It takes more time, and also this has got no impact on the treatment. Okay. That is what we are trying to say, because this is an emergency, very busy emergency night. Okay. Tell the patient that it usually takes about 6 weeks to heal if cared properly. It is not properly, it is cared properly. Okay. So, we can just we will be suggesting them some complementary therapies and some management, and we can so they may be asking about the recovery, the time for recovery and all. As such, we can make them aware that it may take generally 6 weeks for a complete recovery. Okay. Provide information about caring for the toe. So, we need to inform the patient regarding how to take care of their toe. Okay, it is given like ice pack every 20 minutes first few days, elevate the foot above heart level to reduce swelling and pain, try to rest. Okay, that is what. So, these are some complementary measures that we can ask them. Fine. reassure the patient that painkillers, ibuprofen and paracetamol usually work, but to contact his or her GP if there is no improvement after 2 to 3 weeks. So, now we can suggest some on behalf of doctor, we can suggest some painkiller medications like my ibuprofen, paracetamol and all. After that they may be okay. In case if there is no improvement, in case if the patient feels like no improvement after 2 to 3 weeks, we can ask them to come for a review. So, now it is a busy weekend. So, that is what we are suggesting all these things. Okay. So, hope all have gone through the question. It is clear all of you. Okay. Hope the session is clear to one and all. So, we will start discussing the things. Okay. So, there are some more there are certain things that you need to keep in your mind. So, this is a busy weekend and also the patient has been waiting for some long. Okay. Yes, now we will go for our discussion. How can we start an introduction when it comes to our role play, this particular role play? What is an introduction that we can give? Anyone has any idea? So many are watching me. So, if you are giving me some sort of comments means that would be of a great help. So, I could interact more and more freely. This session would be more interactive. Yes, anyone has got any idea how to start this? So, good evening, obviously we can start, we can welcome them to the department, we can ask, okay, how may I help you? Yes. So, in midst you will be getting these questions. So, now I am just for discussion part for displaying this notes, I am just giving you taking this question out. Okay, yes. So, good evening we can consider, this is a fresh case, unknown case, we can start. Good evening, please come in. Good evening, please come in. Okay, please have your seat. Good morning, good evening, not good morning, it is good evening, it is a busy weekend night. Good evening, please come in, now you may please come in. Okay, good evening, now you may please come in. Okay, sorry for inconvenience, I know that you are waiting for long. Okay, you are waiting for some time. So, all those things we can consider. Yes, good evening, now you may please come in. Good evening, now you may please come in. Okay, sorry for inconvenience, I know that you were waiting for some time. Okay, I am the charge nurse, I will be working with you. Please have your seat. So, they will be like, please help me, nurse. I cannot tolerate this pain. I have been waiting for long. So, I feel like my toe has cracked. I got a cracked or broken toe. Okay, so please help me, nurse. So, we can again we can consider the patients. Oh, I'm sorry, what happened? Are you able to walk? Okay, I'm sorry, what happened? Are you able to walk? Please hold on to me. Come lie on this cot. We can make them settle peacefully. I'm sorry, what happened? Are you able to walk? Make sure that you people are using your proper intonation. Oh, I'm sorry, what happened? Are you able to walk? Please come lie on this cot. Feel comfortable. Please relax, relax, feel comfortable. So, we are making the patient down. Okay, we are making the patient calm and composed, relaxed. Oh, I'm sorry, what happened? Are you able to walk? Please hold on to me. Come lie on this cot. Okay, please feel comfortable, relax. Can I have a quick look and assessment? Okay, can you show me where actually it hurts? Can you show me where actually it hurts? Can you show me where actually it hurts? It is on my toe, nurse. Okay, okay. So, it is on my toe. Please have a look on that, nurse. Sure, now I will do the assessment. Sure, I will do the needful. Sure, I will do the needful. Okay, sure, I will do the needful. Before that, can I have your full name for my documentation? Can you spell me your name for my documentation? Can you spell me your name for documentation? So, they will be giving your name, detailed name they will be giving, and your age, and your age, and your age. That also we have just collected. We have just made the patient comfortably placed and we are collecting their details. Okay, hope you people are getting me what I am saying. Yes, all of you. So, this is how. Okay, so do you have where it hurts? That means indirectly we are asking about the pain, and are you able to walk? So, these things, the first task, generally we have just given a beautiful introduction according to that particular scenario. This, if you carry out this role play like this, no, that will be something very different. Okay, it will be something novel. Okay, you could fetch an added score. Okay. Okay. Yes, so the patient will be giving you the details. Oh, nurse, please tell me, please assist the, please have a look onto that area and tell me whether whether the toe is broken or not. Nurse, tell me that. Oh, please see, nurse, whether it is broken. Okay, tell me whether it is broken or not. So they will be okay asking you. Well, thank you for allowing me for my examination. Thank you for allowing for thank you for allowing me. So the assessment is over. Okay, so thank you for allowing me. The assessment is over. Okay, I could see some sort of swelling. Okay, the area is quite reddish black, it is swollen, and okay, so I could see that it is quite swollen and it is having some discoloration, some reddish swollen bumps I could notice over your side, but I cannot tell you that for sure whether it is broken or not, right? I cannot tell you that for sure whether there is any fracture, whether it is broken or not. So that is what it is given like. Okay, the procedure is, okay, we explained that you don't know whether it is broken or not. Okay, well, thank you for allowing me. The assessment is over. See, the area is quite reddish swollen, but I cannot tell you that for sure that the toe is broken or not. Okay, so what would be the procedure, nurse? What are you going to do with me? So they would be in a state of agitation. They will be anxiously asking to you, please relax, you please relax. See, the whatever the thing is, that the diagnosis will be made by the doctor, and for that, when it comes to treatment, the procedure is same. When it comes to treatment, the procedure is same. The procedure is same in broken toe as well as a badly hurt toe. Okay, the procedure is same in a broken toe. The procedure is same in a broken toe as well as in a badly hurt toe. We'll be applying a bandage. Okay, we'll be having a dressing and we'll be applying a bandage over it. Okay, so you'll be having a dressing and a bandage taping will be there. Okay, so the same procedure is done in both badly hurt toe as well as in broken toe. Okay, we'll be having a dressing and a bandage taping will be there. We'll be having a dressing, you'll be having a dressing and a bandage taping will be there. So you don't have to worry, it is a simple procedure and that will give you a quick relief, I assure, please relax. Okay, I assure, please relax. So that is what when it comes to the second task. Okay. So the patient would be asking like, oh nurse, please send me to an X-ray. I've been waiting for so long. Please send me to an X-ray. I want to see. So the X-ray will help me in my treatment. No, please, I want to take an X-ray. Just send me to that X-ray room. Okay. So what you can say like, well, Mr. Martin. So we are taking the name as Martin. Every role play I am taking the same name Martin. Okay, well, Mr. Martin, I understand what you are saying, but now I don't think it's right time to go for an X-ray. So you can see here, you have been waiting here for some time. See, we have got a very busy weekend. Okay, it takes much time to get through an X-ray. Now doctors are quite busy here, and I don't think there is no significance for an X-ray now. I don't think there is no I don't think whether there is any significance for an X-ray now. Okay, so this is not actually for X-ray, won't serve for the treatment. Okay, X-ray is not X-ray is not for X-ray may not serve for the treatment purpose. It's a diagnostic procedure. It is a in an imaging procedure. It's a diagnostic procedure. It may take some time, and I don't think whether there is any significance of an X-ray now. I don't think there is an significance. I don't think there is a significance of an X-ray now. I don't think there is any significance of an X-ray now. I don't think there is any significance. I don't think there is any significance of an X-ray now. So we are just repeating that. Okay, that sentence I'm making it clear. Okay, well, Mr. Martin, I understand what you are saying. See, we have got a very busy weekend right now. Our doctors are very busy. Now I don't think there is any need for an X-ray. Okay, I don't think there is any significance of an X-ray now. Okay, it may not serve for the treatment purpose. It is an imaging procedure. It has nothing to do with the treatment. Okay, moreover, it may take much time. Okay, it may take much time for an X-ray to be done. So now our hospital is very busy. So I think it is better to continue with supportive management. So I think it is better to continue with supportive management. We can try some complementary therapies that will help you to have a relief from this present complaints. Okay, so that will help you to have a relief from this present complaints that you are suffering. Okay, so that is the thing that we are making the patient well. I understand what you're trying to say, what you're saying, Mr. Martin, but for time being, we cannot think of an X-ray. We have got a very busy weekend right now. Our hospital is full. Our emergency department is full of patients. Doctors are running from, doctors are very busy. They are running from corners to corners. Okay, they'll come and have a look onto now, and they will prescribe you. Now, I don't think there is any significance of an X-ray. Okay, now I don't think there is any significance of an X-ray, because it seems to be because it doesn't seem like there is it doesn't seem like a fracture. Okay, because it doesn't seem like a fracture. It doesn't seem like a fracture. Okay, instead we can, I feel like we can continue some complementary therapies. We can continue some complementary therapies that will help you to have a relief from this present complaints. Okay, that will help you to have a relief from this present complaints. Shall we discuss? Shall we have a little chat on the management? Shall we have a little chat on that management? So, the patient will be asking like, oh nurse, what is that? Actually, I am not interested in all these complementary therapies. I want to have some definitive management. I am not interested in this complementary therapy. Just tell me what you are going to do. Let me see whether I can try it or not. Well, Mr. Martin, as I have told you, the treatment is both. Treatment is same in both cases, whether it is broken toe or badly hurt toe. The treatment is quite common, and this complementary therapies we are applying to almost all the patients who are here with your situation. These are the complementary therapies we apply with all the patients of your situation. Okay. See, firstly we can try some cold packs. See, it is given like we can try some cold packs after going home, after taking your discharge. Okay, after taking your discharge at home, you can try cold packs or ice packs or cold compression for every 20 minutes. Okay, okay. First a few days, for every 20 minutes you can try ice pack or cold compression. That will help you a lot in relieving your pain, swelling and other discomforts. Okay. Yes, and it is very important, it is very imperative to elevate your foot above the heart level. Okay, and it is very imperative to elevate your foot above the heart level. Okay, so there would be adequate venous return, adequate blood flow, blood return. Okay, so that we can ensure adequate blood flow, blood return, adequate blood flow and blood return. It also contributes in reducing your swelling and other discomforts. Okay, reducing swelling and pain. Okay, try it, and it is very essential to take rest for first few weeks. Okay, and it is very essential to can have this dressing and bandage taping, and it is very essential to take rest for first few weeks. Okay. So, the patient would be reluctantly agreeing to that statement. The nurse, I am not interested in all this complementary therapies. I feel like I should go for some definitive management. Okay. So, I want the doctor to be here and I want to go for some, but let me see whether I could try this, or just tell me what you are trying to say. Okay. Just tell me what you have for me. Okay. Just tell me what suggestions you have for me. So, the patient would be asking you, well, Mr. Martin, I understand. See, people of your situation, they all are trying this complementary therapies. Now, for us, the doctors are very busy. They are running from patients to patients. They will, of course, you are our priority. The doctors will be here soon. They'll be having a look at you. After that, they will be prescribing you some management. For time being, you can try some complementary therapies. After going home, it is very essential to take rest for first few days, and you can try cold packs, ice packs or cold compression for 20 minutes for every 20 minutes for first few weeks. Okay, first a few days. After that, make sure that you are elevating your leg above the heart level. Okay, you are elevating your leg above the heart level. So, it ensures adequate blood flow, blood return, and reduces swelling, pain and other discomforts. Okay. So, these all will do a great help in managing your situation. These all will do a great help in managing your situation. Okay. Try it and see what changes does it make. Try it and see what changes does it make. Okay. I think all my dear students are there with me. Yes. No one is responding. Whatever it is, I want all of you to listen to this, write it and practice it. Okay. Yes. So, how does that sound? Will you be able to try that? How does that sound? Okay. Will you be able to try that? Okay. So, the patient will be saying like, yes, that sounds quite logical, nurse, but tell me how long does it take for a complete recovery. They will be asking you how long does it takes for a complete recovery. They will be asking you how long does it takes for a complete recovery. Yes. So we can tell them like, see, generally it takes, it is given like it usually takes 6 weeks to heal properly. So if you adhere to the instructions outlined, Mr. Martin, I value your fields. Okay, Mr. Martin, it usually takes 6 weeks. Okay, if Mr. Martin, if adhere to the instructions properly, you can say like that, Mr. Martin, if adhere to the instructions properly, it may usually resolve within another 6 weeks. It may usually heal within another 6 weeks. Okay. Yes, you will be having that question there. If adhere to the instructions properly, Mr. Martin, it usually resolves within another 6 weeks. Okay, it may, you will be having a completely recovery within, it may usually resolve, so you may be having a complete recovery within another 6 weeks. So that is what the instruction that we can give. Okay, so nurse, what should I do if I am having pain after, still I will be having pain after few weeks. Okay, so the patient will be asking, like, what will I do generally if the pain persists, or if the pain continues, what will I do, nurse? Okay, tell me, nurse, even if I try all these things, if the pain still persists, what I will do? Okay, so they will be asking you that. So we can reassure the painkillers, ibuprofen, paracetamol usually work. Okay, well, I understand. I know that you are concerned, but nothing to be overly concerned about. I know that you are quite anxious. I know that you are quite concerned, but nothing to be overly concerned about. Now the prescriptions will be given for ibuprofen and paracetamol. Okay, these are the usual prescription in these cases. Okay, will be having prescriptions. The doctor will be giving prescriptions for ibuprofen and paracetamol. Doctors will be giving prescription for ibuprofen and paracetamol. You can try that. These are effective painkillers. These are effective painkillers, and I am sure that you will be having no pain after starting the course. You will be having no pain after starting the course. But at the same time, if you, as you said, if the pain still persists, okay, even if the even if the pain still persists, even if the pain persists or continues, or if you experience something unusual or any unpleasant sensations, okay, even after 2 to 3 weeks, make sure that you are here to the hospital without any delay. Get back to us immediately. Okay, so I understand, I know that you are quite anxious, but nothing to be overly concerned about. Now you will be getting prescriptions for ibuprofen and paracetamol. These are effective painkillers. These are effective painkillers. Okay, so generally if you complete the course, there won't be any pain. Okay, there won't be any pain, but in case, as you said, if you experience something unusual or unpleasant, and in case if the pain persists even after 2 to 3 weeks, never delay, get back to us immediately, get back to the doctor immediately, we will do the needful. Okay, get back to the doctor immediately, we will do the needful. Okay, there is nothing to worry about. No worries, you will be all right for sure with this, I am sure. Okay, no worries, you will be all right for sure with this if you try this management. Okay, there won't be any sort of complications or other problems. Okay, stay confident, stay confident. But oh sure, nurse, I'll try that. Yes, do you have any, is there anything, do you have any other queries for me, or is there anything else that you would like to ask or discuss? Is there anything else that you would like to ask or discuss? So they'll be saying like, no, nurse, there is nothing else to discuss. I'm very happy. So what I have to do now? Now you please relax, feel comfortable, you take rest here. The doctor will be here soon, and we will prescribe the management. Okay, so now you please relax. Okay, so now you please relax, please feel comfortable. Okay. So, what I have to do, the patient will be saying like, okay, so it was really helpful talking to you, nurse. So, what I should do now, nurse? Okay. So, that we can say like, now you relax. Okay, now you relax, feel comfortable, the doctor will be here soon and will prescribe you the necessary advice. Okay, stay relaxed. Okay, doctor will give you the necessary prescription and I hope you can go home today itself. I hope you can go home today itself. That also we can just okay. So, now you relax, feel comfortable, doctor will be here soon and will prescribe you the management, okay, and will give you the necessary advice, will give you advices. Okay, doctor will be here soon and will prescribe you the needed necessary advices. Okay, so you can I hope you can go home today itself. Okay, please relax, stay relaxed. Okay, stay relaxed and please feel comfortable, stay relaxed. That is what we can go to, we can just end up the conversation by saying that. Okay, so please feel comfortable, I will be here around, that also you can ask. Okay, now you please stay relaxed, feel comfortable, doctor will be here soon and will prescribe you the and will give you the necessary advice. Okay, and I hope you can go home today itself. I hope you can go home today itself. No worries, you will be all right for sure. No worries, you will be all right for sure. Stay relaxed, I will be here around. Stay relaxed, I will be here around. That means we are there at the premises. For any help, they can contact us indirectly. That means, okay, indirectly, what that does means. Okay, that is it. Okay, indirectly we are trying to say them that we are there with the patient in case any if there is any need, they can approach us. Okay, stay relaxed, I will be here around. That's it. With that, we can finish the conversation. Hope the discussion was okay for you all. So, thank you all for your participation. Thank you all for your cooperation. So, get me your feedbacks, your comments and all. We are looking forward to get your comments and we would be able to improvise ourselves. We would be able to improve myself. Okay, we would be able to improve our classes, our sessions if you get us some, if you pin your comments and suggestions to us. Okay, so my prayers, all the very best. So, see you all on next Tuesday for the same live session. God bless you all. Take care.